Hi everyone, I'm Russell Pinto and I am a musculoskeletal and sports physiotherapist with 10 plus years of experience in the field. As promised earlier, that we would be getting across to you a wide range of conditions and problems that people suffer in their day-to-day life, and how do we as physios deal with it, and what you could do best to get yourself back up and about quickly. So the topic that I chose for today is something called as ankle sprains. So it is something that's the most common condition that you would find. You're just walking down the street and you just twisted your ankle on a boulder or on a small rock or in a pothole. That's common in India nowadays. So you just twisted your ankle and all of a sudden you've got a swelling in the ankle. You're not able to touch your foot down to the ground and you don't know what to do. So yeah, so this is something that is a common question that we get as to, okay, you know what, I have an ankle sprain, what do I do next? Okay, so before we go to that, let's just understand the basic anatomy of what the ankle joint is. As I promised earlier, I don't want to speak to you as a physio, but I'll try to keep the terms as simple or as common as possible so that people understand. So let's just have a look at the ankle joint. Okay, so as you can see, this is the foot. I'll keep it as layman as possible. This is the foot and this is your leg. So this is the inner side of your foot where the arch is, and this is the outer side of your foot. If you see any pain or swelling in the outer side of your foot, so this is known as the LCL injury, or the lateral collateral ligament injury, so which is the most common ankle sprains that you see. Now if you turn it, this is towards the arch on the inner side. This is known as the deltoid ligament, also known as the deltoid ligament sprain or the inner side sprain. And if you kind of twist your ankle in this direction, it's possible that you get a high ankle sprain in this particular area. So yes, so if you twist your ankle in this direction, that is the most common one that we see. That is the LCL ligament injury that we always see. If it's in the opposite direction, which is the deltoid ligament, that is the medial or the inner side ligament that can get injured. Or if you just fall flat on your foot with your foot tucking inside and you falling flat on it with all your weight, you can injure the ligament that is present between these two bones, that is the tibia and the fibula. Okay, so these are the basic and the most common injuries that you would see. But before I start, I would like to talk about the inner side of the ankle. Let me tell you one thing, that this is one of the most strongest ligaments that's present in the human body. So usually it's very difficult to tear or injure this ligament, and if you do tear it, it's always usually with a bone fracture or a bone that comes out along with it. So that's called an avulsion injury. So it's not that common, first of all, and if it does happen, it is basically with a bone fracture and a bone injury. It's always better to immediately visit your orthopedic specialist or your doctor to get further answers and your course of action. Whereas now, let's come to the most common, that is your LCL ligament. So this can happen is if your ankle twists in such a way that your full body weight falls accordingly. So this can cause an injury on these ligaments. There are three ligaments over here. As is with all conditions, there are three grades in this particular injury. There's grade 1, grade 2 and grade 3. So grade 3 is something which is you will need a surgical opinion. You will need to speak to an orthopedic surgeon, whereas grade 1 and grade 2 are the most common ones, and it's something that you can treat by yourself or using a physio in a conservative manner. So what do you do? So there was this common belief earlier, okay, you know what, I've just sprained my ankle. The first thing I do is I ice it and then I strap it, right? So this was the common belief earlier. However, current evidence and current research states that it's best not to do that, right? Usually ice would be put. The idea behind icing a particular joint is to make sure that it gives you a kind of a painkiller relief. You know, you get some relief in pain, you reduce the swelling in the area. But the current belief is that why would you want to ice something that the body is trying to heal? Right? Okay, when it sends in the swelling, when it sends in a few things to heal that particular area, why wouldn't you want that, you know? So this is the belief and the mindset that people have currently, is that, okay, you know what, let's not ice it. Okay, you can support it, you can strap it, but let's not ice it. So if you are someone who loves ice and you feel, okay, this is what gives you relief, you could try it. But the current evidence suggests the opposite, that you should try and avoid icing for that particular injury as of now. What you could however do is you could use a crepe bandage. You can support the ligament in a way that it gets some relief and there's no strain on it or stress on it. So the first 2 days usually would be in trying to rest the ankle and to try and reduce the pain and the swelling that is there around. But as I said again, the current methods would avoid ice and any anti-inflammatories. Just let it be and let it stay for a while. After 2 days is when you would try to focus on your movements. You would start moving the ankle a little bit, trying to see that it gets into action. You start loading the ligament, you start bearing weight onto that particular ankle, and then after that you can start off with some strength work, some balance and proprioception exercises to make sure that your ankle doesn't twist again. And so there's an entire process that needs to be followed up on rehab. Some of my teammates here at Physiotherapeutics will be uploading or speaking about a few exercises and rehab techniques that you could use for ankle sprains, and it is something that you could follow for as a 1 to 2 week rehab process based on the severity of your ankle sprain, and it is something that would help you and guide you as to what you could do if you get this particular condition. So please look out for our videos ahead. Look out for this space. Look at the description. As we mentioned earlier, there's Physiotherapeutics on all the possible on all the social media handles that we have. We would be dropping in this beautiful video on what to do when you have an ankle sprain in the future, and please do feel free to get in touch with us either via the social media or visit our website, and you could contact us via the contact us page, and we would be glad to help you out. We've got clinics all across Goa, in Panjim, Margao, as well as one coming up in Vasco. You could also visit us in Mumbai at Waves Gym in Lokhandwala, and we would be more than happy and glad to assist you or help you with your process of rehabilitation of your injury. So wish you all the best in the recovery, and see you soon.